Now, Jennifer Rein, she's a clinical social worker at Boston's Children's Hospital in the Division of Endocrinology. She will be talking about a family affair.
Thank you. What a rough act to follow. What a wonderful speech. I have nothing to disclose. Today I'm hoping to give you general information on some psychosocial aspects of coping with chronic illness, talk briefly about some family affairs, specific to the patient, parents, and siblings, and also some practical applications. Initially, it's helpful to think about, can everybody hear me? Am I in the... That's my problem always. There. Is that better? Okay, wonderful. Excellent. So first, it's helpful to think about life in more of a conceptual model, so to come from the way far out and then kind of focus in. Initially thinking about psychological factors, so who is the person? Who is the person that we're speaking about? How do they function? Are they a picky eater? Are they a fantastic athlete? What sort of makes the human being we are talking about tick? Next, we pull in the family piece, so mothers, fathers, brothers, sisters, favorite aunts, favorite cousins, how all the family function works and how that impacts the individual. Next, thinking about the biological, so we've talked a lot about uveitis today, right? So how is uveitis impacting not only the human being, but the family structure, and how everything sort of works itself together, all resulting in the patient's well-being, right? How all this impacts each other and how we all can focus on the individual, recognizing that there are many different components. There are so many common reactions to a diagnosis, especially a chronic diagnosis. I've only put a few up here. This feels like a small number of how people feel when they hear a chronic illness diagnosis. Uveitis, how do you spell it? Maybe the first question, what does this mean? And all of these feelings can swirl around in your mind, in your heart, and sometimes feel a little more dominant, at other times not so much. It's important to honor feelings. Coping with chronic illness is very different for every person. For parents, it tends to be much more, let's find out as much as we possibly can, let's inform ourselves, let's learn. And for children, most often, we're just living life, right? School is important, friends are important, and as much as a chronic diagnosis impacts day-to-day life, school kind of takes over, right? Friends take over, sports teams. So it's important to make sure that there's some recognition that people are coping at different levels and at different developmental stages. Brothers and sisters often have very different reactions than the actual patient who's diagnosed. The other piece that's extremely important is to honor any sort of previous context or previous history with chronic illness. Oftentimes we have preconceived notions, or a previous history could include cancer or death or something that is not necessarily accurate or a true reflection of what's going on with the patient. And there might be a lot of ambivalence. You want to know what's going on, but then also really just need some help and guidance walking down this path. It's important to also recognize loss, that oftentimes a chronic illness can feel like a loss. I always review the grief cycle. This is a very old conceptual model, but it's extremely important throughout all aspects of our lives. So to remember that this grief cycle is something that can occur at any time, that all of these emotions and feelings can it is cyclical, so you can be in denial in the beginning. Oh no, this can't possibly be true. Feel very angry. The bargaining piece, oh gosh, if I just do everything exactly right and I do everything I'm supposed to do, this will go away. It will be like it's never happened. And then sadness, depression can creep up at any point in time. And then acceptance. Again, the importance is that all of these you can experience at any point in time. Parents, children, siblings, it's sort of interchangeable. And again, recognizing that loss is really key. The loss of health and the loss of an anticipated childhood. This is a little comic. I don't know if you can read it, but it says, you'll need to bring yourselves up. So parent and caregiver concerns. Oftentimes parents feel a little bit of disempowerment, guilt, grief. Perhaps there's something that they did to cause uveitis. Maybe there's something that they could have done to prevent this from happening. Finding fault or assigning blame. My background is in endocrinology, and I do a lot of work with children who've been diagnosed with type 1 diabetes. I can't tell you how often we try to find one food product that is the cause of type 1 diabetes, and there's no cause. There's no food cause. So thinking about how we really create stories to make sure that those stories are actual and factual, and going back to your providers to make sure that you get that information as concretely as possible. Being afraid of the future, being afraid to send your child back to school after this incredible news has been delivered. And again, that previous experience with a chronic illness, if somebody else has had a negative experience or some sort of a terrifying experience, that might be coloring what's going on. Again, lack of reliable information is really problematic. Google is a wonderful thing, but it also can be very detrimental. Making sure that the information that you find on the internet or that you find is through reputable sources. Again, this chronic illness is sick. Understanding what is cyclical, what is progressive, understanding possibilities of what could happen, the unpredictability of chronic illness is really important to remember. I always tell my patients it's really challenging to be an A student with a chronic disease. And what I mean by that is, again, you do all the homework, you do all the research, you pass all the tests in on time, but there might be something that, we missed. And so to just strive for competence and for making sure that your quality of life is rich. And medical choices, understanding what are the risks, what are the side effects. Medication decision-making is really challenging when you're not somebody who is in the medical field all the time or needs to understand what is going on. So making sure you ask those questions that are very pertinent and that are also extremely basic. I always tell my patients, make the doctor do work. Ask the questions that you want to know in as simple terms as possible. Again, everybody's goal is a high quality of life for the entire family. When we think about family functioning, I'm always asked about burnout. Oh gosh, this is exhausting. We're always worrying about health and how's everything going. And I think that Andrea pointed out clearly that it's not just the child with uveitis, but it's the family, the brothers and the sisters, and how everybody is coping. Siblings can often feel left out. It is not something that they would necessarily be active participants in, so not going to medical appointments or feeling that they are not getting as much attention in the family. There also could be other social stressors going on, older siblings going off to college, a divorce, grandparents passing away. So there might be things that are going on that are also taking precedence and get in the way of making sure that uveitis is sliding down the to-do list and becoming part of life rather than dominating. So impact on brothers and sisters, I've alluded to this a little bit already, but sometimes brothers and sisters react in a way that comes out as jealousy, and that they want to be sick. They want to be sick too, so that they can get as much attention as the patient who has been diagnosed. There are so many things to do to help that child feel included. Many ways of just making sure that they have a special day with a parent, and I always encourage those days to be non-financial. So a day at the park. If there's a movie that the entire family wants to go see, everybody goes and sees the movie. But cheap to free is the way to go, right? So that there is some way of including and having family activities that everybody enjoys. Again, they often feel isolated from the medical experience. It's not common for brothers and sisters to go to medical appointments, and it isn't common for them to be allowed to ask questions of medical providers. If there's a way to pass a notebook back and forth or to have questions, these are the family questions, so that those brothers and sisters do feel included and feel like they have a part. Oftentimes, siblings and very close friends who often feel like brothers and sisters are concerned on two levels. Number one, they're concerned about the patient. Are they okay? Is everything going to be fine? And number two, they're concerned about themselves. Is this going to happen to me? Could this happen to me? And so making sure that you ease minds and help with again, concrete, simple understanding will go a long way. Frequently you'll find that brothers and sisters may have some magical thinking around diagnosis and might make up stories to fill in the blanks. If they don't know what's going on in a very concrete, factual manner, they might make stories up about what happened and where their brother or sister was. Some school issues to just be cognizant of, that academic, there's a wonderful booklet on the table out there for teachers and parents that goes through fantastic accommodations in school, but to make sure that there's some basic understanding of what a child with uveitis might need, considering a 504 plan or an individual education plan, and making sure that you talk to school personnel about which one is most appropriate. Working towards understanding that peers may also have questions and that the questions may feel very invasive, and working towards some understanding on a classroom basis that you will have to leave the classroom to go to the nurse on occasion. There might be school missed that's a little bit more intense, and then having just some knowledge and understanding of that is very helpful. So again, the primary aim is preserving childhood, right? We want to make sure that this child who's diagnosed with uveitis is first thought of as a son or a daughter, a boy or a girl, a brother or a sister, a wonderful athlete, has a great sense of humor, that the human being is presented first. I try my best, and I hope I've done it throughout this presentation, to talk about the child who is diagnosed with. Even language puts some distance between the person and the diagnosis, so that the person is really honored as who they are in the world. And I always say this too, that your picky eater is your picky eater before uveitis and after uveitis. So that personality traits tend to stick around, and to remember to treat kids diagnosed with uveitis the same as you always would, parent the same, and make sure that life moves on and uveitis is down on the bottom of the to-do list. So this one says, Daddy, can I stop being worried now? So hopefully we'll move on to the patients. So again, very similar train of thought. So children often mirror what their parents are experiencing. While we try to be protective and parental to our children, we often inadvertently show anxiety, inadvertently show our worries on our faces and our hand gestures, tone of voice, what we do, who gets privilege in the home and who doesn't. And so when we're anxious, it's very easy to transfer that anxiety onto a child. And very much so during the new phase of diagnosis or whenever there's a change in treatment. Changes often bring about a whole new set of anxiety. So one of the biggest pieces is going public. So how to tell your friends, how to tell family members. Again, if you're in this phase of not fully understanding what is going on or really having a lot of questions of your own, how to tell and who to tell becomes a much bigger deal than maybe it deserves. So one of the things I often recommend, especially with preteens, kids who are entering into a middle school situation, or even like the 4th and 5th grade, because those tend to be pretty intense academic years. But to create a list, and sometimes this is fun to do with a guidance counselor, or sometimes it's just nice to do at home. But to have a need to know list and then a nice to know list. The need to know is definitely the school nurse, your teacher, anybody who is responsible for any sort of medical caretaking. Those folks need to know what's going on. The nice to know is your friend, your peer in your classroom, so that there are these other people who might care about you and who might want to know what's going on medically, simply because they want to check in and make sure that you're okay. Those lists tend to I get some feedback from teenagers that, oh, that's really dorky, I don't want to do that. But oftentimes it's very nice to have some sort of sense in your mind of who is important to know and who isn't. There's a definite stigma of feeling different. Sometimes you look different, sometimes you don't. And those feelings of, gosh, I'm having a really difficult time seeing today, but nobody else can tell because I look just fine. That can be very challenging, as well as perhaps there are times when you do look different and there is something going on, and feeling very isolated that nobody else has uveitis, nobody else feels this way, and it's simply not fair. I was talking to Frances last night, and it sounds like there are so many wonderful support opportunities, and the art day today sounds fantastic as well. So that's nice ways of connecting with others who are like me. The impact, again, adherence. So sometimes taking medication or being as vigilant with a medication regimen just feels exhausting. And keeping up with that, with taking medication or choosing a different medication when the one you're on seems to not be working as well, can be very challenging. So again, there's a lot of anxiety from the parent, there's a lot of anxiety from the patient. And so making sure that the information is factual, clear, and as simple as possible, so that everybody really understands what's going on and why. Understanding and having very clear information is often helpful when moving on to the next step. Again, there's the loss, right? Loss of control. So if you're feeling like, I really liked this one medication, I felt comfortable with it, and to know that it isn't working can feel very much like another loss. This is very important. I won't read all of this, but it's important to just be cognizant that chronic illness and depression are linked. And this is old data, but they've all been replicated in the very near future, very near past. But that depression and chronic illness is something that should be considered. Reflecting back on the grief cycle, it could be very cyclical, it could be related to a change, it could be related to a life event, but that oftentimes a chronic diagnosis really kind of ups the ante in terms of mood. So being very aware of that and just being open to discussing feelings is highly recommended. So how to help? Again, speak in facts, very concrete, dispel myths. That storytelling. Kids may have been telling themselves stories about what is going on, but you want to make sure that the story is accurate and that it belongs to the child, and so that they have some ownership in what's going on. Don't be afraid to say, I don't know. There are questions that I'm asked on a pretty much daily basis where I do not know the answer, and it's kind of fun to go together and find out, hey, how is this working? What does this mean? Provide choice as much as possible. So yes, we can either choose this one or choose that one, but always making sure that the choices are simple, and that you're always able to follow through. Also, I always say consider therapy. It's very difficult to cope with chronic disease, and to make sure that there is some outlet to talk about it as much as possible. And not necessarily to think only that the patient who's been diagnosed with uveitis is in need of therapy, but that perhaps there's some other family members who could also benefit. Again, this is chronic disease impacts the entire family, and thinking about who may benefit the most or who is ready. Oftentimes it's about being ready. And the reason to consider therapy is simply to make sure that it's helping intertwine and intertwine uveitis into life, so that it is not so dominating, it is not so overpowering, and that it becomes a part of day-to-day living that is not seen as something that's resentful or burdensome. And therapeutic interventions should be very, very simple. Again, starting with listening, what's going on. Again, it's different for every family member. It's different at different developmental stages. And as time passes on, incorporating uveitis into your life is something that may change. Feelings around it could also change. So that and it's also focused on problem solving. So what is going on that's outside of uveitis? If there are feelings related to a divorce or to a change, that those are also honored. Very much normalizing feelings that yes, there are other people diagnosed with uveitis and they cope this way, or some cope that way, and perhaps we can learn from each other. And making a plan, a very concrete plan. We're going to talk on this day at this time every week, or we're going to work on making sure that there are other parts of your life that you really enjoy, more dance class, another soccer team, to really enhance quality of life. And then develop goals. Make sure that these goals are child-driven or patient-driven. The person who is most interested in getting something. So I could make a goal for somebody, and if it's not what they're interested in, it's not going to work. So the goal has to be patient-centered. Again, when we think about adherence, again, the overwhelming, exhausted feelings of, gosh, taking medication is a pain in the neck. My friends don't have to do it. They don't have to think about this. But fostering adherence is, again, something that everybody can participate in. And it can be something, you have a favorite teacher who's really interested in making sure you're doing well. That teacher could be included, medical providers, anybody who you think of who's involved with life on a day-to-day basis who can be helpful. Sometimes best friends who are so worried about the child's health and well-being, they tend to be wonderful motivators to say, gosh, I really want to do this with you. Let's make sure health is a priority. And then building resilience. So adjustment over time is really helpful to remember that what is intense right now may not be intense even in a month, in a week or two. It's something that happens and incorporates into your life. Practical resources are often available. School personnel are usually very helpful. School nurses can help with making sure that children feel like going to the nurse isn't so stigmatizing. Visual aids during extracurricular exams or extracurricular activities, visual assistance in the classroom, any kind of social support. Again, the online support groups here or the support groups that Francis runs sound fantastic, but making sure that making everything as consistent and routine as possible. And I think I've mentioned before, just making sure that parenting is consistent prior to diagnosis and post-diagnosis. You could be in a cranky mood, and it's just a cranky mood. It has nothing to do with uveitis. So the take-home points. Start with communication. Always start with communication. I can't emphasize that enough. We have so many ways of communicating nowadays: email, texting, instant messaging, and if talking human being to human being really, really makes a difference. Keep it simple. If there's things that you don't know, ask. Make sure that you find out the facts as much as possible, and work towards something that is that's a compromise, that you're making plans together. There will be times that parents want something and a child wants something, and it's a little bit different. So finding some commonality is really important. Respecting each other, being compassionate towards each other, and partnership, making sure there's a strong partnership is very important. So this is the last one. I think you guys can read that better than I can on here. But I'm staying together for the sake of my parents, is what this one says.